Let's revisit the signs and symptoms of monkeypox and what we can do to prevent infection. Joining us now on the phone is infectious diseases expert, Dr. Rontgene Solante. Good morning, Dr. Solante. Thanks for taking our call.
Hi, Ria. Good morning.
Now, Doctor, we have the country has detected this fourth case of monkeypox. Is this a reason to be alarmed? Because we've seen how contagious COVID-19 is. But what about monkeypox? You can't catch it as easily, right?
Yes, definitely. You need a very close contact, prolonged contact with someone with skin lesions. And most of the time, the contact here should be really intimate. And the patients usually are highly infectious once they have the skin lesions that are appearing in the upper extremities, lower extremities, and even in the body and the face.
All right. So how long does it take for a person to be infected with monkeypox after exposure if they have had the close contact you described?
Usually it will take like 5 days. After the exposure, you'll have fever, and then you'll have lymphadenopathies. And then thereafter, 4 to 5 days after that fever and lymphadenopathies, the skin lesion will start to appear. And I think most of the time, skin lesions will evolve from vesicular, pustular, until it will crush, no? And it will take around 21 days, Ria. That's why the infectivity period usually is quite longer. As long as you still have that skin lesion, then you're still highly infectious.
All right. Doctor, talk to us about which members of the community or the population are most vulnerable to the virus, because reports say that the infected range from 5 years old to adults.
In most countries where these are reported now, outside of West and Central Africa, there is this vulnerable population that are most of these patients are being documented, and these are the men who have sex with men. And this can only tell us that the most common mode of transmission is more on intimate sexual encounter. Okay? And usually with multiple partners, you can transmit this with this close sexual intimate contact, and that's where most of the transmission are occurring in this population.
Okay, doctor, so far we don't have any specific vaccines for monkeypox in the Philippines. What is the plan to procure these vaccines?
The Department of Health, I think there are already plans and in terms of procuring this vaccine. Just that this vaccine has been really in demand in other countries, and you know, when we are in this part of this region, it may not be the priority, but I hope WHO can also help us in terms of procuring that vaccine. And Ria, this vaccine is not for everyone. This is not for the general population. This is mainly for the high-risk, vulnerable population that are currently being monitored now, who will be high risk for getting the infection.
All right, and there's been talk in the past about smallpox vaccine, since the monkeypox is sort of a relative of smallpox. Does having been administered a smallpox vaccine mean that you have some level of protection against monkeypox?
Yes, actually the vaccines that are being used now for monkeypox are the vaccines also that used with smallpox. So, which means for those who have received smallpox vaccine, then you may have some level of protection. But for those who have not been vaccinated yet, then this is where the risk will be higher for close contacts with known monkeypox case.
Do we have an idea, doctor, of how many Filipinos have been vaccinated against smallpox from childhood, for example?
Well, as far as I know, those aged 50 years old and above are mostly the ones that has received the smallpox vaccine. But below that, so it's really counting those who are 50 years old and above. I'm sure they have received that smallpox vaccine.
All right, doctor, thank you so much for speaking to us here on New Day. That was infectious diseases expert, Dr. Rontgene Solante.